Welcome back to part 2 of the urinary system, learning all about the PP. If you remember from part 1, we learned primarily about the kidneys, was the main thing we talked about. Just flip back real quick. We learned about the kidneys, we learned about the nephrons that make up the kidneys, we learned about urine and what it's constituted of. And now we kind of start moving into disorders, diseases, infections, the like that. Excuse me. And also we'll learn a little bit about the bladder and the urethra. So anyway, this is one disorder, glucosuria. Glucosuria is elevated glucose or blood sugar, you can think of it that way, in the urine. A lot of times this will occur in people with diabetes. You'll hear about glucosuria with diabetes. It can also be if you had an IV of glucose for some odd reason. Most likely it's going to deal with, hypoglycemia or hyperglycemia. But anyway, have glucosuria. It's a good way to tell. You might also hear that website y'all dealt with yesterday. It talked about your urine smelling sweet. Can be a sign of diabetes, or if your blood glucose is rising abnormally, it's a little too high. That's what this condition is called, glucosuria. A more well-known disease or disorder of the kidney, excuse me, I got distracted for a minute, is kidney stones. Kidney stones, if you've ever had one, you wouldn't wish it on your worst enemy. I've had at least one that I had to get broken up with. It's kind of interesting. They use seismic wave technology, so like the same things that do earthquakes. It's a machine that pulsates these seismic waves, so it's not invasive. They don't have to cut into you or anything like that. They use this thing to crush them, to pulverize them through your skin, through your muscles, through the soft tissues, and through your kidneys, which is kind of neat. But anyway, they are not fun. If you know anybody that has them, they'll most likely tell you they are no fun. They'll double you over real quick. What they are deposits these stone type material. It's not really stone, but we'll see what it's made of here in a second. It gets collected in the kidneys. And sometimes, normally they'll pass through the ureters. Remember, the ureters are the two tube structures that come down from the kidneys down to the bladder. They'll kind of get hung right here coming out of the renal sinus into the ureters, get a little stuck, and that's what causes the immense pain. If they're small enough, they can pass through, and you may not realize it much till it gets to the urethra, and there's pain involving urination, and so coming out. Males and females both can have kidney stones. Some people believe males get more. It's not necessarily true. We're going to look at some factors that affect kidney stones, and that may play a role, but it's nothing to do with your sex. So what are they made out of? Uric acid. We've seen that's found in urine, so it can be elevated levels of that. Remember, gout's also associated with that. Calcium oxalate, calcium phosphate. So there we see just some chemical mixtures of calcium with different type elements, and also magnesium phosphate. Now, what causes them? That's what we really want to know, right? One of them is dehydration. Dehydration, if you don't have enough fluids, enough water primarily moving through your kidneys, all these other waste products that go with the fluids don't fully get washed out. So they kind of just sit up inside your sinus medulla, that middle part there. They kind of get just stuck in there without fluids passing them through. They keep collecting more and more of these deposits that come through, and you're left in a situation. If you're eating lots of calcium-rich foods, things like that, you also hear doctors tell you drinking certain liquids, a lot of them in excess can cause kidney stones. Some people relate it to milk, drinking a lot of milk. There's, of course, calcium. Things like sweet tea with lots of added sugars and things, and soft drinks as well. And a lot of times with that, it just comes with dehydration. Those things have so much solubles in them, like sugars, that they just kind of get stuck in your kidneys. How do we prevent kidney stones? Oh, also some foods, especially things that have oxalate in it, peanuts, spinach, chocolate. Chocolate can also be one. So anyway, those type of things, if you eat excess of them, sometimes it can leave kidney stones. How do we get rid of them? Stay hydrated. Sometimes if you just experience some pains, you can flush them out by drinking a good bit of water. Now, people's got their at-home remedies for kidney stones. People say, oh, I drank a 6-pack of Coke. Or if you're of age, they might say drink a 6-pack of some beer or something like that, and it flushes the kidneys. All that's doing is just doing the same thing as water. If you just drink a whole lot of water, it'll cause these kidney stones to get flushed out. The more water you drink, the more it gets put in your blood, the more it gets pushed through the kidneys. So more fluids pushing these kidney stones, hopefully, out. If they are big enough, let me look at this. Okay, here's an x-ray showing this is a severe case of kidney stones. Obviously, that person's going to need some seismic waves to break those up, or possibly surgery if they get big enough. Here's what they look like. This is, the renal sinus opening here, parts of the medulla. It's also a great picture of the cortex. You can kind of see how they look different even in color and texture. But here are some kidney stones that were embedded in there. These might not be able, especially that one, pass through the ureter and exit the body. So they stay up in there. Now, some people, going back, they live with kidney stones for a long period of time because they kind of can't go down the ureter, so it hurts, it feels pain, then it pops back up in here and just stays for an inordinate amount of time. Hopefully, they're small enough to go through. From personal experience, mine was the size of a pencil eraser, which sounds like no big deal until it tries to start going through here. It got caught in the ureter, and so I couldn't pass it on my own. They had to use seismic waves to break it up, and then it came out in a bunch of sand. All right, so kidney stones. Moving on from kidney stones, if you got any questions about kidney stones, it's always an interesting topic because of the pain associated with it. I mean, you'll have full-grown men and women that are so tough, just doubled over, from kidney stones. So if you got questions, we can talk about it. The urinary bladder, so after, hopefully our urine leaves our kidneys, goes through our ureters, it enters into our bladder. The bladder is a hollow, so it's empty on the inside, expandable. It's like a balloon is one way to talk about it. Muscular organ that stores urine. And from there, it's going to force it into the urethra, where there it's going to exit the body. Now, something interesting, the linings of the ureters and the urinary bladder are continuous. I liken this to how the heart and blood vessels, they have this continuous flow. There's not a stop gap. It's not like it got to fall off an edge to get into the bladder. It's continuous. But with that, it makes them prone to infection. So think about how that plays out. If you get an infection in one part of your bladder, it can easily move along that lining and even up into the ureters. Now, hopefully, you go seek medical advice before it gets to your kidneys, because once it's in your bladder and in the ureters, you're going to know. You're going to feel the pain from that, unless there is something wrong with your pain receptors. So females tend to have more bladder infections, and you'll hear these called UTIs, urinary tract infections. And that's just kind of an umbrella term because it could be in your bladder, could be in your ureters, it could be in your urethra, certainly probably is, and even up in your kidneys, so the urinary tract. But females have more UTIs or bladder infections than males because they have a shorter urethra. As this urethra exits the body, it only has to go down to the outside of their body, through the urethra. It doesn't have any external type organs to pass through. Males, of course, has a penis, and so it passes down through there. So males can certainly get UTIs, they do, but females are more susceptible to those because of that shorter urethra. The infection could start in the urethra, most likely is going to, because think about how you get an infection, some pathogen, if we're dealing with some bacteria or something like that, enters into the body. There's a doorway in. Once it goes in there, gets in the bladder, easily to infect other things prone to it because it's a continuous lining. So females, more susceptible. Micturition, or urination, as you common people call it. Micturition is the process that expels urine from the body. So let's talk about the bladder briefly. It can hold about 600 milliliters. That's roughly about 20 ounces. 20 ounces, somewhere about a liter-ish. I'm not caught up with all my measurements. Go ask Mr. Agee if you really want to know. I just look at it like this. A can of Coke is 12 ounces. Okay, so a regular old soda can is 12 ounces. It's bigger than that, not quite 2 of those. It can hold that. It can hold a lot more than that, actually. But it can hold that before stimulating pain receptors. It always interests me, especially with like ninth graders when I teach them. They're like, "Oh, I got to pee so bad, I got to go." I'm like, "When did you go last?" "Well, this morning, just an hour ago," or something like that. I'm like, "Well, your body probably didn't make 20 ounces of urine in that time, so you'll be okay." And here's how I know this. The urge to urinate, when you first go, "Ooh, I kind of got to pee," begins at about 150 milliliters. 150 milliliters. That's about 5 ounces. So even less than a half a can of Coke. Okay, we get that feeling. Think about it right now. Now I'm talking about it, you probably think, "I got to pee." I do. I think about it. I'm like, I could go pee right now. I could go micturate or urinate right now, but I'm not feeling that pain. Okay, and even when you have those pain receptors, you can deal with it. You can still suck it up. A lot of times you'll think about something else, especially if like in a car ride or something like that. Anyway, and the reason you can deal with it is because your urethral sphincter. The sphincter is a part, we've learned about a sphincter before, like your end of your anal cavity, your butthole is a sphincter. A sphincter is a section of muscles that pinch together. Okay, your urethral sphincter is composed of skeletal muscle. Remember, skeletal muscle is voluntary, and it's also, that means it's under conscious control. We can control it. We can hold this. It's that same sensation when you go to the bathroom, whether you're sitting down or standing up, whichever sex you are and whichever is more convenient for you. You can release this sphincter. You have that ability to go, and release it, and urine comes out. Okay, that's why we can hold it. So even when you have those pain receptors going off, the bladder's made to expand. It's an expandable organ. It can keep filling up even when you start feeling like, "Ooh, I gotta pee," and doing your happy dance, your little pee dance. I guess it's a happy dance. Your urethra, we already brought it up. The sphincter. This is the tube that transports urine out of the bladder to the outside of the body. So females coming right out near the opening of the vagina, more anterior to that, and then or in front of, and for guys coming out the penis. Incontinence is a term that's used for the inability to control urination. We see this in the elderly sometimes, and also people that's had certain medical conditions. They can't control their urination. It's not anything to be ashamed of or anything like that. It happens with time. There's also something called stress incontinence. And this is when your abdominal pressure is increased because of like coughing or sneezing. It causes incontinence, your inability to control urination. The pelvic floor becomes weak. These muscles that hold everything up and everything becomes weak. So that's what causes that. Again, you see this in the elderly, but you also see this in people, say like people that's gone through pregnancy or pregnant even right now. Their muscle floor, this pelvic floor, starts to stretch and make room for the developing fetus. Also, the fetus is pushing on your urinary bladder. So when you cough, you sneeze, all of a sudden you might pee a little bit. Okay, it's kind of interesting. In society, we make jokes and we laugh and things like that. But incontinence, I mean, it's a part of life. We deal with it. The adult diaper industry, or whatever we call them now, that's even insensitive. To say that is, $1 million industry, I would guess. And it's because people have these problems and we have to learn to deal with it. If you're going in the medical field, you need to learn that these are parts of some medical conditions. Just seeing how far we got here. Oh no, I'm going to have to do a 2-part video. Retropubic suspension. Retropubic suspension is a technique, a surgical technique, where you actually, it fixes incontinence. You tie the bladder neck and the urethra kind of together. Well, not really together. You stitch them to the pubic bone. It raises them up. It kind of causes a bend to occur. A catheter is a hollow tube that's put into the urinary bladder. Yep, it's got to go through the urethra and up into the urinary bladder. If there's an obstruction of some kind, this opens it up. This opens these things up. Now, catheterization is more difficult and uncomfortable in males because you have the extra tissue that comes with the penis. The female, you just have to go through the urethra up into the bladder. Male, got a little longer way to go, and it causes it to be more difficult and uncomfortable. With that said, certainly not a walk in the park for females. So you may want to just pause these. I'm going to run through them real quick, but instead of doing extra notes, you can read, because that's what I'm going to do. This has to do with thirst. It's actually in the brain. Diuretics promote urine production. And the last slide right here. Make sure you pay